Kmar Humphrey, the sister of Jermaine Ifill, told the newsroom that her brother called the coronavirus hotline 3 times before he finally decided to visit the Georgetown Public Hospital on March 25. He was admitted immediately in the male ward, where he was told that he had pneumonia. He died on Tuesday, March 31, at around 9 hours 30 in the COVID-19 intensive care unit after he tested positive for the disease on Saturday, March 28. Humphrey, during a telephone interview with the newsroom on Wednesday, said her brother was treated for pneumonia in early 2019 and always had a coughing problem. But Ifill, who was an emergency medical technician, EMT, started to feel sick and weak 3 weeks ago after he returned from the Saudi hospital on the Essequibo Coast in Region 2, where he trained staff in basic CPR and other first responder courses. Ifill co-owned and managed the Reliance Healthcare medical company.
You know, we know him with his cough whole year through. As soon as he laughed too hard, he would cough and this and that. So we know nobody take it for anything. He himself must take it for nothing.
Mm-hmm.
So he ended up starting feeling sick, 2 weeks in. So he was calling the hotline. Really do your own research and things. He ended up calling the hotline numbers and stuff like that. And he called them 3 times. And nobody didn't come. They said they didn't come, they didn't call. Nobody didn't come, nobody didn't call. So he decided to go to Georgetown Hospital last week, Wednesday, and this is when they admit him. So I called him and I was like, you sure you okay? He said, yeah, he just needs rest. He's feeling a little weak, so he just hooked up his own saline at home and he was using it.
Mm.
And so on. Then his wife telling me that he called them 3 times instead of coming, nobody didn't come and this kind of stuff. So he went to the hospital last week when then they run the test and then they tell he's pneumonia.
The sister said Ifill was kept in the male ward where he was being treated for pneumonia. She said his breathing was unstable and he had complained of being given the wrong mask. His 6-month pregnant wife, who is a nurse at the Georgetown Public Hospital, bought him a non-rebreather mask, which was helping. According to the sister, she managed to convince the doctors for her brother to undergo a COVID-19 test, which was done 3 days after he was admitted to the hospital. When the results came back positive on March 28, he was immediately moved from the male ward into isolation. Following Ifill's death, a friend released on social media a screenshot of Ifill wearing a baby mask, complaining of being given the wrong mask. The sister confirmed this message.
He had this problem with this mask. Some masks that they were using, he had to get the non-rebreathable mask, the ones with a bag at the bottom of it. And apparently, he wasn't getting that mask. I don't know if Georgetown Hospital. But when we went to the hospital the Thursday, his friend that run the company with told and tell them that this is not the right mask this guy has to use. He has to get the non-rebreathable mask. And his wife went and because she's working at the hospital, and his wife went and get this mask and hook him up and put it on him. So I don't know what is the problem now with them and since he go in isolation, it's all kind of thing they're doing to my brother. Because he gotta be out messaging us, asking us to get oxygen tank for him, asking me to get mask and all these things. I spoke to my brother yesterday morning after 2 going on to 3, 4, begging me for get mask. He said he need mask. He gotta get mask. That was after that message there. He talked to me after 2 going on to 3. I have my own set of messages, but that message there is we message that person there telling them that he need help. Maybe that the person must be in charge of the hospital or something that could help you get mask. And you see, we saying it's suffocating, it's punishing, he can't breathe because you're supposed to cover your mouth. That's a small mask. And you could tell me doctors up there in that room, he punishing and struggling. They're not going to find a better mask. Look how much hours he passed with 9:30. You can see the time, these pictures, when you see the pictures, see the messages, what time he begging for mask. They had a couple hours where you tell me the whole hospital in get mask.
She also debunked reports that the family breached security and hospital protocols.
Nobody couldn't see him. We were taking his stuff that he's asking for. guava juicy coconut water to the matron's office. Nobody in preach not because nobody gonna go where he is. He in isolation.
Okay.
I used to drop the stuff at the matron office.
Humphrey believes her brother did not receive adequate care. The family is now awaiting word from the hospital on when the body will be released and when Ifill's personal belongings will be handed over to the family. Ifill's wife, the sister said, was placed in isolation on Sunday after she too tested positive for the new coronavirus. According to Humphrey, the wife, who is in her mid-20s, is not showing any signs or symptoms, and she is said to be recovering. Meanwhile, Ifill's one-year-old son and mother have been quarantined at their Georgetown home, but they have not been tested for the disease. Humphrey said the Ministry of Public Health has promised to visit and spray the house, but they have not done so. Ifill became Guyana's second COVID-19 death. The country is currently battling 19 cases as of March 31. Reporting for the newsroom, Fareeza Haniff.